Welcome listeners to yet another edition of Health Talks from Lourdes Hospital. I am Dr. Lisa this side, and we are introducing Dr. Vandana, the dermatologist in-house Lourdes Hospital. Today we are going to talk about a condition called as Hirsutism, which is a condition which relates to excess of facial hair in the face for women predominantly. We have Dr. Vandana here who will talk more about this condition. So doctor, tell me, what is hirsutism and what are the features that we see in this particular condition?
So when we define hirsutism, it is basically development of thick dark coarse hair in a female body but in a male pattern. So let's see what's the male pattern. Usually all the males, they have hair growth in the beard area, their mustache, chin area, chest, lower abdomen and thigh areas. When such growth pattern is seen in females with those thick and dark hairs, that is called hirsutism.
So doctor, tell us more about what can predominantly be the causes that could lead to this hirsutism.
Okay, so before going to the causes, I would say which are the sites when these hair grows and when women should be more aware if they are getting hirsutism or not. So mostly upper lip, chin area, sideburns, nipple area, lower abdomen, thighs. As I said, these are the sites where men get hair, and when the female is getting, that's hirsutism. So there are many causes. The first cause is genetics. Why it is important is because some people genetically might have hair at those areas, like their mother had, their sisters have. So they don't need to be treated because it's genetic, it's familial. Then the second most common cause comes as hormonal. There might be hormone imbalance and patient is having hair growth due to that. Then they can be the most common cause nowadays we see as PCOD or PCOS. So hirsutism is one of the we can say a cardinal feature of PCOS nowadays. Then there are certain drugs like anabolic steroids, and there are a couple of more drugs which can lead to hair growth like hirsutism. And then even menopause, in which there is a relative reduction of estrogen and increase of testosterone, which is a male hormone, can lead to apparent hirsutism. Then there are certain cancers or tumors which are of adrenal gland origin, they can lead to hirsutism. So these are the main causes which leads to hirsutism or increase hair. And I would like to just mention that there is a condition called hypertrichosis, which we should not confuse with hirsutism. Hypertrichosis is basically when there is in general hair growth all over the body but not to those specific site as I mentioned. And hypertrichosis need not to be treated as always. It can be genetic also. There might not be any underlying hormonal imbalance. It's just a generalized overgrowth.
So doctor, is hirsutism always associated with PCOD, and is it related to obesity as well?
As I mentioned, these causes like hirsutism can be associated with many causes, but most common nowadays is in our generation is PCOD or associated with obesity. But I would like to tell you now lot of people don't know that obesity is not the only reason our women or girls are having PCOD. There is a term called lean PCOS, in which the females who are lean, they look lean but they do have menstrual irregularities, they have facial hair, and they have other features like PCOD patients have. They have acne in their lower jaw and chin area, and but they do have PCOS. So we should know that not only obesity or not only PCOS can lead to hirsutism, but other causes have to be ruled out. That's why the importance of visiting a dermatologist or a gynecologist comes.
That's nice, doctor. It's quite insightful as to what hirsutism is all about. We would like to know, the viewers also would like to know, what should a woman do if she has facial hair, and does that always have to be treated, or can we let go of it, or we need to treat it? That is, like, I'm sure a lot of women are so aware about their appearances, and is there a reason that women should address to this condition?
Okay, before addressing this question, I would say hair or no hair, you're awesome. So you have to see look for the other signs. If your only facial hair is coming, and you have to observe your body. If there is any menstrual irregularities, you are getting acne, you are having visceral obesity or central obesity. What is a central obesity is mostly women, when they gain weight, it's in the thigh area or in the hips area, while men gain in the abdomen or the, like when we call tummy area. But in central obesity, female tends to gain weight in the tummy area. So when these features are there, they should always visit a gynecologist or a dermatologist to get themselves evaluated. So accordingly, you have to get treatment. It's not just that you have to treat your hair only. It is a full body or a full evaluation you have to get.
What are the methods of removing this excess facial hair, and is there any kind of permanent solution? I'm sure the viewers would want to know about it.
Definitely. So this is my favorite question. So there are many methods. If I talk about temporary methods, there are many, starting from shaving, waxing, hair removal creams are there, even trimming you can do, threading you can do. These are very economical methods, but they are temporary and they are associated with many side effects. So if I talk about, say, you're getting waxing every month. So waxing is definitely painful procedure, especially over the face. It can lead to open pores because the hair is coming out through the whole follicle, it is coming out, and that portal, that's a port of infection which patient might get. Patient comes to us that they have been getting monthly waxing over their hair, over their face for the hair growth, and they present with many acne because I have seen like they get it done in a beauty clinic and they do this very mechanical massage over the face which leads to acne eruptions, many acne over the specific lower jaw areas, and you can have folliculitis, you can have redness. So but it's you get a clean look, but these are the pros and cons of waxing. Second is bleaching. Bleaching is basically, it's not doing anything to your hair shaft, but it is just coloring your hair, and it gives an illusion that matches your skin tone. So it gives the look that you have just fine hairs and it is matching your skin. But you have to repeat it definitely, and harsh bleach can give redness, especially in the dry skin. So you have to always do a patch test and keep the interval little longer. Then we talk about hair removal creams. They are okay, but again I would say always do a patch test, and these are very temporary methods, have to be repeated in a very short interval.
So doctor, does this cause blackening of that area, like usually a lot of people say with chemicals?
Yes.
That is one of the biggest contraindications,
definitely.
right? Yeah.
So basically blackening doesn't start as first stage. It can lead to inflammation, like it starts as redness, and patients are not using sunscreen on a regular basis. That redness or the inflammation, when subside, it can lead to post-inflammatory hyperpigmentation. So okay, so then next method, it's a myth is about shaving. So it's all over the YouTube, and it's like shaving increases the hair growth. Lot of women are still they are fear to shave their facial hair. They think that the growth might increase, the hair which are coming, they might be more dense, more thick.
Like a stubble maybe.
Yes, yes. But it's not true. It's medically proven. The diameter of hair has been taken pre and post shaving. So I would just explain how we see our hair. When we see our hair, we are seeing the most thinnest part of the hair outside. So when we shave, we just cut them from the surface. So when that surface we see, that is the widest part of the hair, that might look more black. But number of hair follicles are decided at birth. It's genetic. It cannot be increased with any method or any medication. So shaving, definitely you can go for it, but it's a temporary method. You might have to repeat it say in 2 weeks. Some women their growth rate is higher. It can be like weekly or even 3 weeks they have to repeat it. So those are the cons. So if you talk about a permanent solution, see, nothing, no treatment can lead to 100% loss of your hair and you will have a clean face, no hair follicles. That can't be done. And the most
Photoshop
safer,
that as well. We could only Photoshop
yes,
that.
Yes, definitely. So those filters maybe.
Right.
But we have laser hair reduction. So it's not a laser hair complete removal, but a reduction. And in 90% of the patient, we can achieve 80 to 90% of hair reduction, but not 100%. So what laser does and what other methods does not do is laser finally over after 3 to 4 sessions, you will start seeing result. When when you do a laser, your upcoming hairs, next cycle of hair, they'll be more fine, they'll be light colored, and you can, in between the sessions, you can shave them, you can use any temporary methods also. So with laser, definitely the interval of using your temporary methods can be increased up to 3 to 4 months. If initially you were shaving every 3 weeks, every month, the interval can be increased up to 4 months, 5 months, and later on you might need just touch-ups. So that is the advantage of laser.
So doctor, that was very insightful again. We'd like to know, like, who should get a laser hair reduction done primarily, and are there any contraindications? Like, there's a myth in the market that if you get laser treatment done in a particular patch of area, there's a chance that it might grow in another area altogether.
Yes.
So could you just clarify on all those fields basically?
Yeah, that's a good question, because it's not like if you have facial hair and you decide to go for a laser hair reduction, it doesn't work like that. An ideal candidate for a laser hair reduction is a person who has thick dark hairs, because laser works by targeting melanin in our hair, and if there is no melanin, the other fine hairs, they might get stimulated and they might be increased hair growth. The term is called paradoxical hypertrichosis. So we have some patients who get their laser for some fine hairs because they didn't want that peach first look over their jaws line, and they come up with increased hair growth over the other areas where there were no hair initially.
Very true.
So you have to definitely visit a qualified dermatologist before getting laser hair reduction and see if you are ideal person to get it done or not.
So thorough awareness about this condition is very, very important before even attempting to think about which treatment modality will suit the patient. Any cream has to be applied to reduce the hair growth like pertaining to this condition?
As such, there are no creams which will stand alone work as to reduce the hair growth. We have one topical or one cream formulation which is eflornithine, but that works only when the patient is undergoing laser hair reduction. So it helps in reducing it inhibits the enzyme that keratinizes the hair and makes it thick. So it helps in maintaining that fine hair which are coming in your next cycle. But standalone, it doesn't work.
That's very nice to know about the cream as well. What are the psychological impacts that a patient suffering from this condition could basically feel like? Of course, the confidence, the self-esteem takes a thorough beating. Other than that, what kind of issues are you seeing on a constant basis in your consultations, doctor?
There are many actually, and see, we are living in a world where outer look or how do we look gives a lot of importance. So these, especially women and the young females who are suffering, they are already, like if they have PCOD, they might be obese. They're already feeling embarrassed, social embarrassment because of their outer look, and when they have facial hair, it's kind of tedious. It adds and it gives them frustration when you have to do certain thing, every 3 weeks, every 2 weeks you have to go out. No, I can't go out because I have to get my facial thing done. So those are things that leads to embarrassment and isolation, anxiety. Those things are very common in such females or in such young girls. And I would say, see, if we talk about laser, so honestly, it's definitely an expensive procedure compared to other temporary methods, but in long run, it's more saving. But it adds to the financial burden, it's economic burden to the person and the family also. So that definitely adds up to their stress.
Can you just tell us a bit about the pain quotient related to laser therapy? Are we looking at any kind of because many people, they are scared or skeptical to go for any kind of treatment, thinking that it might be very painful. So could you just enlighten the viewers on that?
Among all the methods which I talked about, I think laser hair reduction is absolutely painless, no pain. Only you will feel a mild heat if you are undergoing laser hair reduction, otherwise there is no pain, and there is mild redness you can have immediately after the procedure, which will subside within 24 hours, but otherwise there is no major drawbacks or major adverse effect or pain.
Thank you, doctor, so much. I think Dr. Vandana has answered most of the questions which we have asked the patients, through the consultations that we have come to know about these queries. For more information, the patients can definitely get back to us at Lourdes and meet Dr. Vandana, get a consultation from her. We definitely want to help each and every woman out there grow in their self-esteem and be self-empowered. So this is signing off from the help desk. Have a lovely day.